Hello, I'm Tim Fuchs, and gosh, what a privilege it has been to be here today and just to look through the amazing array of extraordinary projects that have been done and to hear some of the really powerful work. And I think, if one takes anything from today, from my point of view as a GP, what an incredible place it is to work in the NHS, what a privilege it is to be on the front line of working with patients and trying to make a difference in a positive way to what they do and their lives. And thank you so much for your talk about pancreatic cancer. And I have patients who are dealing with that at the moment. And what you've done and what you've said is so important to me and to my patients. But I want to talk to you about what we've been doing with the Pacesetter Award, and just from the grounds of primary care. One of the things you've got to remember that actually primary care is such a busy place, so much going on, such pressures, and we get lost sometimes in this quality improvement agenda about making things better for patients' journeys. And it may seem daft because there are literally millions of consultations going on every year in this country in primary care, and yet there's so much assumptions being made that somehow we just automatically know how to do things well for children and young people in primary care, and we don't. And most of the ways in which the NHS encourages to improve what we do is through top-down approaches that say, well, do this, count this, act this way, and we'll give you another slot of money, which we've taken off another budget to give you. And it trains primary care to become focused in a wrong sort of way about quality improvement. Because what it does mostly is take us away from our patients to think about quality and makes us focus on measurable targets. And what we've tried to do, working with Christine McDermott, who's here today as well, to try and develop a way in which we can learn together how to improve quality in primary care in a way that is shareable, but most importantly is based on our knowledge and understanding and the wisdom and the intelligence and the smartness of the people that we look after. So we started it with this aim to be bottom up in our approach. And what I'll just quickly run through is what we've learnt and what we can share. This slide came from the CMO's 2013 paper on improving the lives of children. And it shocked me at that time. I've been involved in commissioning for children and young people for some years now, by the way in which it demonstrates how the UK has moved in a bad way in its position in terms of being one of the least good performers in the Western world for child mortality. And some of that is based on what goes on in my part of the NHS world. And I felt we had to do something about that. And what we've seen also in my particular world is less people getting trained or less guarantee of doctors becoming trained in paediatrics before going into primary care, and less understanding now about what the impact is going to be as we try and reduce antibiotic use, how we encourage parents to make use of us at the right moment, how we encourage them to come to us rather than them to minor surgery, minor illness clinics in A&E. So many things that are going on. And it's just very tempting to carry on trying to design things the same way. And you've got to follow this particular thing. And I love this cartoon, because unless we think differently about where we're at, we won't make a change. We've got to step out of what is normal and do something differently. And today I've just seen that over and over again. So thank you for that. So we've done lots of work prior to the actual Pacesetter project. We've developed great pathways. We've looked at developing work with patients on advice sheets. And doctors have said this has felt good for them and they can look after people better. And there's lots of the work that we've done which is available for you to look at. But Pacesetter is based around these four elements: patient and staff engagement, accessing services, how we do that better, how we get best clinical practice and care in place, and how we educate and equip people to do it. And this is a way of thinking about it. What drives this process of improvement is the intelligence, the brain power from the engagement between primary care and its patients. That's what starts it, that's what drives it, that's what gives it its energy. What we do for our patients, our lifting of our arms out to them to support them, is our access. It's energized, of course, and powered by best possible practice and care, but it stands on the foundation of education and equipment. You're educating both, not just our staff and the doctors, but also our patients, how best to make use of care, how best to make use of resources. Fantastic apps that we've heard about to help young people access care most sensibly. And in our particular project that we've set, which is in a sense a framework for improvement, it's been exciting for us to find that actually in our area, the mental health teams are wanting to use this as a framework to take into their particular area of primary care improvement. It starts with 2 mandatory activities of 5 that each practice has to do who wants to become a pace setter. It requires that patient engagement. We set out some principles about how they do that, and we now have lots of experience which they can use, real life experience of how they can do that effectively. And we ask them to do a really solid safeguarding review, because there can't be really anything in my world of children and young people's medicine that isn't absolutely grounded in ensuring children are always safe. And we know that from in my own practice, the way in which we've looked and improved the way we look after safeguarding and ensured we do our safeguarding process even better has been tremendously helpful. And then from that, we asked them to develop 3 different projects. Some of them you've heard about already today, and it's been wonderful for me that Patience Okori has come up and told you about her project that she's done in her practice in Crawley, which is part of the pace setter process. St Lawrence Surgery in Worthing was another project that's come up a couple of times today in the award ceremony. It's done their project on passports for additional needs children. And my own practice, where one of my colleagues did some fantastic learning for a project for staff. So they have 3 different practice-specific key activities and these 2 mandatory key activities, and they do it at their own pace. So what happens is that they agree with us what they're going to do, they set out, do those projects, they come back to the team that's been looking after them and supporting them through the process, and when they've achieved what they want, we celebrate together and we bring practice together and celebrate and learn and share what we've learnt about. The time ticking on, I've mentioned some of these things before. But what we've found is that where we've done these projects and people have come together, not only have you had the benefit of those particular projects delivering something successful and it being something of their own and not something top down, they've actually had a sort of culture shift, and that they've actually started to look, as one of my colleagues said, through pace setter eyes about actually how to do something differently. And actually you get a knock-on effect. And for primary care, I can tell you just at the moment, it's a real antidote to the sort of kind of CQC agenda that we sort of are living with at the moment. Each area has an award panel, and that's made up in each of your areas wherever you chose to do pace setter, and this is something available for any of your areas to do. You'd set up a team that can work together, and we, from learning from what practices have done working with their patients, we've set out in our data some calibrating exercise that we have. We have a website resource, but we've had this independently evaluated to make sure that what we're doing is grounded in some sort of sense, and a quality expert has been able to go through it very carefully and is writing it up now as well, but has been able to produce an independent evaluation to say that what we've done and are doing stands up to scrutiny. But other peoples have looked at this for us as well. And perhaps most exciting for us, Jackie Cornish, who is the head of the National Director for Children and Young People in Transition, has thought this is a great project and one that should be celebrated. And one of the most wonderful times for me was hearing a colleague of mine, Tim Ballard, who was then the Vice Chair of External Affairs at the Royal College of GPs, saying that he came to the celebration event of seeing the energy and excitement of these practices coming and talking about what they've achieved with their patients, just saying it was one of the best days he's had in the last year. He was blown away by it. So I think it's really encouraging when you can be part of something that just excites people as much as these have been. So I encourage you to think about it, but most of all, I just want to say thank you for letting us participate in it and for all that you've all done in your different areas. Thank you.